If you're looking to get your health in check this year, there's a way to do that this weekend, all for free. Dr. Gerardo Lopez Mena and Elisa Mares with Doctors Hospital at Renaissance here to talk about the 11th annual health fair. Welcome, you two.
You're welcome. Thank you for having us.
Great to have you. And Dr. Mena, I want to start with you. Let's just first talk about the common illnesses that are going around right now.
Yeah, so more often you'll have your common colds, and they're called common colds because they usually happen around the wintertime. You have a lot of viruses that are affecting, like rhinovirus is one of the most common ones that you have sinusitis, you have congestion, but also the CDC is reporting that this year the flu season, influenza, is much stronger this year than last year. Luckily, they chose the right strains to give vaccinations against. But they're reporting that only 2 out of 5 people got the vaccination. So I really push for the vaccination for everyone. They can still get it and it's still effective.
Yeah, just like you said, that some people might think that, oh, it's too late to get the flu vaccine, but you can still get it because, like you said, this is when it's probably the most active.
Yeah, and I'm finding that a lot of individuals are coming, and what they'll do is they'll get a viral infection for the first 6 days, 5 days, and their immune system is weakened. And so if someone's not getting better after day 5 or 6, I usually say, okay, revisit your doctor because you might have now developed something bacterial like a pneumonia.
All right, and Elisa, let's talk about the health fair that you guys have going on this weekend. What are some of the services that will be offered to the community that goes out and visits?
We'll be having free cholesterol screenings, which is one of the main things that a lot of our visitors come to us for. We'll also be doing, we'll have physicians on site doing dental screenings, vision screenings, checking your blood pressure, your sugar. We'll also have individuals who are certified in car seat inspection that will be checking your child's car seat. So if you have a doubt as to whether you've installed your car seat correctly, we encourage you to come and stop by and visit with us and make sure that your child is not only, that car seat is not only installed right, but that your child meets the minimum requirements for that seat that they're in. If for whatever reason they aren't, we'll have a limited amount of free car seats to give away to those individuals whose child don't meet the requirements.
And speaking of free, all the tests and screenings that you just named off, all those are free to the community as well.
Yes.
So let's talk about, does anyone need to bring anything to get these free screenings?
The only thing we ask individuals to bring with them is an ID, only because we are going to mail those results to them. So something that has a physical address would be great.
And Dr. Mena, let's just talk about how these tests are so important to get that glucose tested or, tested for diabetes. Why is that so important to do now?
So often we're reactionary with medicine. We treat people once they've developed complications, and when that happens, especially with diabetes, your circulation it becomes much worse. And so what we'd like to do is become preventative, and I think that is the way to solve medicine. We know that medicine as a topic is not sustainable, and so we really at DHR are trying to help prevent disease before it causes any problems with our patients.
Definitely. Is there anyone out there in the community that should come? Is there any symptoms, or if they have like a family history of a certain disease? Those are probably the people who really do need to come.
Without a doubt, anyone with family history, but I would say everyone, because we know that diabetes is very prevalent. Down here in the Valley, it's more prevalent than anywhere else. We have the highest rates of liver disease than any other place in the country, and so I think that with hypertension, with CAD, all those coronary artery disease, I think everyone should come and be tested because these diseases are reaching epidemic proportions.
All right, and there you have it. There was an address on your screen. Thank you, you two, for joining us.
Thank you for
Thank
having
you so
us.
much.